What is the primary pharmacological action of expectorants? A. Promoting cough reflex. B. Increasing mucus production. C. Assisting in removal of mucus from the respiratory tract. D. Inhibiting mucus formation. The correct answer is C. Expectorants help remove mucus from your lungs, making it easier to cough up and get rid of. What is the typical mechanism of action of emetics? A. Suppressing the vomiting center in the brain. B. Stimulating the vomiting center in the brain. C. Increasing gastric motility. D. Blocking dopamine receptors in the gut. The correct answer is B. Emetics work by stimulating the vomiting center in the brain, leading to vomiting. Which of the following is a common emetic agent used in cases of poisoning? A. Potassium iodide. B. Copper sulfate. C. Sodium potassium tartrate. D. Ipecacuanha. The correct answer is D. Ipecacuanha is a commonly used emetic agent in cases of poisoning. It induces vomiting to expel the toxic substance. How does potassium iodide work as an expectorant? A. By thinning mucus secretions. B. By increasing mucus production. C. By suppressing the cough reflex. D. By reducing inflammation in the respiratory tract. The correct answer is A. Potassium iodide acts as an expectorant by thinning mucus secretions, making it easier to remove from the respiratory tract. Copper sulfate is known for its emetic properties. In what form is it typically administered for emetic purposes? A. Oral solution. B. Intramuscular injection. C. Topical cream. D. Rectal suppository. The correct answer is A. Copper sulfate is typically administered as an oral solution for emetic purposes to induce vomiting. What is the medicinal application of sodium potassium tartrate in respiratory conditions? A. Antiviral agent. B. Bronchodilator. C. Expectorant. D. Antibiotic. The correct answer is C. Sodium potassium tartrate is used as an expectorant to help clear mucus from the respiratory tract in conditions such as bronchitis and pneumonia. Which of the following statements accurately describes the use of expectorants in respiratory disorders? A. They reduce inflammation in the airways. B. They suppress cough reflex. C. They help in clearing mucus from the airways. D. They inhibit mucus production. The correct answer is C. Expectorants help clear mucus from your airways, making it easier to cough up and expel. What is the main role of emetics in cases of poisoning? A. Neutralizing the toxin. B. Preventing absorption of the toxin. C. Inducing vomiting to remove toxin from the body. D. Blocking toxin receptors in the gastrointestinal tract. The correct answer is C. Emetics work by inducing vomiting to remove the toxic substance from the body in cases of poisoning. How does potassium iodide act as an expectorant in respiratory conditions? A. By increasing sputum viscosity. B. By reducing airway inflammation. C. By enhancing ciliary function. D. By loosening thick mucus secretions. The correct answer is D. Potassium iodide acts as an expectorant by loosening thick mucus secretions, making them easier to clear from the respiratory tract. What is the mode of action of potassium iodide in treating respiratory conditions? A. Decreases mucus viscosity. B. Increases lung inflammation. C. Acts on the central nervous system. D. Inhibits ciliary movement. The correct answer is A. Potassium iodide acts by decreasing mucus viscosity, facilitating its clearance from the airways as an expectorant. An emetic action induces vomiting. Which of the following statements accurately describes this action of copper sulfate? A. Stimulates the vomiting center in the brain. B. Inhibits the stomach muscles. C. Increases saliva production. D. Blocks the chemoreceptor trigger zone, or CTZ. The correct answer is A. Copper sulfate induces vomiting by stimulating the vomiting center in the brain, resulting in the expulsion of stomach contents. What is one common medicinal application of sodium-potassium tartrate in treating respiratory conditions? A. Relief of cough. B. Reduction of fever. C. Bronchodilation. D. Antibacterial effect. The correct answer is A. Sodium-potassium tartrate is often used as an expectorant to help relieve cough symptoms in respiratory conditions. In what form is copper sulfate typically administered for its emetic properties? A. Oral solution. B. Intravenous injection. C. Inhalation spray. D. Topical cream. The correct answer is A. Copper sulfate is commonly administered orally, in solution form, to induce vomiting effectively as an emetic agent. How do expectorants generally work in respiratory disorders? A. Help in clearing mucus from the airways. B. Suppress cough reflex. C. Stimulate airway constriction. D. Increase mucus production. The correct answer is A. Expectorants help clear mucus from your airways by making it easier to cough up or spit out. What is an essential role of emetics in cases of poisoning? A. To promote rapid absorption of toxins. B. To induce vomiting and eliminate toxins from the stomach. C. To block the effects of toxins. D. To reduce heart rate. The correct answer is B. Emetics are used in poisoning cases to induce vomiting. This effectively removes toxic substances from the stomach before they are absorbed into the body. Which of the following describes the primary effect of copper sulfate as an emetic agent in cases of poisoning? A. Accelerates the toxic effects in the body. B. Reduces nausea and vomiting. C. Induces vomiting to expel toxins. D. Blocks the absorption of toxins in the gut. The correct answer is C. Copper sulfate acts as an emetic by inducing vomiting, aiding in the expulsion of toxic substances from the stomach in cases of poisoning. How does sodium-potassium tartrate help manage respiratory conditions as an expectorant? A. By directly suppressing cough reflex. B. By dilating the airways. C. By thinning mucus secretions. D. By reducing lung inflammation. The correct answer is C. Sodium-potassium tartrate is an expectorant. It thins mucus, making it easier to clear from the respiratory tract. Which of the following is a medicinal application of potassium iodide in respiratory conditions? A. Promotes mucus clearance. B. Induces vomiting. C. Reduces cough reflex. D. Prevents airway obstruction. The correct answer is A. Potassium iodide acts as an expectorant by promoting mucus clearance in the respiratory tract, aiding in the treatment of conditions like bronchitis and chronic obstructive pulmonary disease. What is the key role of copper sulfate in emetic therapy? A. Clearing airway obstructions. B. Inducing vomiting. C. Reducing cough reflex. D. Enhancing mucus production. The correct answer is B. Copper sulfate is used as an emetic agent to induce vomiting. This helps expel toxic substances from the body in cases of poisoning or overdose. How is sodium-potassium tartrate commonly administered for its medicinal application in respiratory conditions? A. Inhalation. B. Injection. C. Oral solution. D. Topical cream. The correct answer is C. Sodium-potassium tartrate is typically administered orally as a solution to help thin and expel mucus in respiratory conditions like bronchitis. What is the primary pharmacological effect of potassium iodide in managing respiratory conditions? A. Nausea reduction. B. Bronchodilation. C. Vasodilation. D. Mucus thinning. The correct answer is D. Potassium iodide thins mucus in the respiratory tract, making it easier to expel and improving breathing in conditions like asthma and bronchitis. In emetic therapy, what role does copper sulfate play in cases of poisoning? A. Relieving pain symptoms. B. Neutralizing toxins. C. Inducing vomiting. D. Preventing gastrointestinal absorption. The correct answer is C. Copper sulfate acts as an emetic by triggering the vomiting reflex, aiding in the removal of toxic substances from the body in cases of poisoning. How does potassium iodide help manage respiratory conditions as an expectorant? A. By increasing cough reflex sensitivity. B. By stimulating airway constriction. C. By promoting mucus clearance. D. By inhibiting surfactant production. The correct answer is C. Potassium iodide helps manage respiratory conditions by promoting the clearance of mucus from the airways, facilitating easier breathing and reducing cough symptoms. What is the primary mode of action of copper sulfate when used as an emetic agent? A. Blocking neurotransmitter receptors. B. Irritating the gastrointestinal lining. C. Enhancing bronchial dilation. D. Suppressing the vomiting reflex. The correct answer is B. Copper sulfate acts as an emetic agent by irritating the gastrointestinal lining, triggering the vomiting reflex, and expelling toxic substances from the body. Which of the following describes the medicinal application of sodium-potassium tartrate in treating respiratory conditions? A. Suppressing cough reflex. B. Enhancing bronchial constriction. C. Thinning and expelling mucus. D. Reducing airway inflammation. The correct answer is C. Sodium-potassium tartrate is used as an expectorant in respiratory conditions. It helps thin and expel mucus, improving breathing and reducing symptoms like cough and chest congestion. In emetic therapy, what's copper sulfate's essential role in poisoning or overdose? A. Absorbing toxins in the gastrointestinal tract. B. Presenting with anticholinergic effects. C. Inducing vomiting to expel toxic substances. D. Triggering the synthesis of antidotes. The correct answer is C. Copper sulfate plays a crucial role in emetic therapy. By inducing vomiting, it expels toxic substances from the body. This is used in cases of poisoning or overdose. How is copper sulfate typically administered when used to induce vomiting? A. Orally. B. Intravenously. C. Topically. D. Subcutaneously. The correct answer is A. Copper sulfate is usually administered orally as an emetic agent. What is a potential side effect of using sodium-potassium tartrate as an expectorant in respiratory conditions? A. Hypertension. B. Gastric irritation. C. Hypoglycemia. D. Dizziness. The correct answer is B. Gastric irritation is a potential side effect of sodium-potassium tartrate when used as an expectorant. How does sodium-potassium tartrate help manage respiratory problems as an expectorant? A. Increases bronchospasm. B. Thins and loosens mucus. C. Reduces cough reflex. D. Promotes lung inflammation. The correct answer is B. Sodium-potassium tartrate helps thin and loosen mucus. It's an expectorant used to treat respiratory conditions. How does potassium iodide act as an expectorant and aid in respiratory conditions? A. By increasing bronchial secretions and thinning mucus. B. By suppressing cough reflex and reducing inflammation. C. By enhancing lung elasticity and improving oxygen exchange. D. By dilating airways and relaxing bronchial muscles. The correct answer is A. Potassium iodide acts as an expectorant. It increases bronchial secretions and thins mucus. This makes it easier to clear the airways in respiratory conditions. Which form is commonly used for administering copper sulfate as an emetic agent? A. Oral solution. B. Injectable solution. C. Topical cream. D. Nasal spray. The correct answer is A. Copper sulfate, when used as an emetic, is usually given orally in solution form to induce vomiting in cases of poisoning. How does potassium iodide help manage respiratory conditions as an expectorant? A. By suppressing cough reflex. B. By relaxing bronchial muscles. C. By increasing mucus production. D. By thinning mucus secretions. The correct answer is D. Potassium iodide helps manage respiratory conditions. It's an expectorant, thinning mucus to make it easier to clear airways. What is an essential role of copper sulfate in emetic therapy for cases of poisoning or overdose? A. Inhibiting gastrointestinal absorption. B. Inducing vomiting. C. Neutralizing toxins. D. Stabilizing blood pressure. The correct answer is B. In emetic therapy, copper sulfate plays a key role in inducing vomiting. This helps remove toxic substances from the body in cases of poisoning or overdose. How does sodium-potassium tartrate help manage respiratory problems as an expectorant? A. By reducing bronchial secretions. B. By suppressing cough reflex. C. By loosening mucus in the airways. D. By constricting bronchial muscles. The correct answer is C. Sodium-potassium tartrate helps manage respiratory conditions. It's an expectorant, loosening mucus in the airways. This makes it easier to cough up phlegm and breathe better. Which of the following describes the medicinal application of sodium-potassium tartrate in respiratory conditions? A. Anti-inflammatory effect. B. Antibacterial action. C. Bronchodilator properties. D. Mucolytic function. The correct answer is D. The medicinal application of sodium-potassium tartrate in respiratory conditions is its mucolytic function, aiding in the breakdown and clearance of excess mucus in the airways. What is the primary mode of action of copper sulfate when used as an emetic in poisoning? A. Reducing toxin absorption. B. Inducing vomiting. C. Neutralizing toxins. D. Inhibiting toxic effects. The correct answer is B. The primary way copper sulfate works as an emetic, or something that makes you vomit, in poisoning cases is by causing vomiting. This helps get rid of the poison. Which of the following is a known medicinal application of potassium iodide in respiratory conditions? A. Laxative. B. Antitussive. C. Expectorant. D. Antipyretic. The correct answer is C. Potassium iodide is commonly used as an expectorant to help with respiratory conditions by thinning mucus and making it easier to cough up. How does potassium iodide work as an expectorant for respiratory problems? A. By stimulating respiratory centers in the brainstem. B. By increasing airway resistance. C. By promoting bronchodilation. D. By thinning mucus and helping it to be expelled. The correct answer is D. Potassium iodide works as an expectorant in respiratory conditions by thinning mucus, making it easier to expel from the respiratory tract. Which of the following is a common medicinal application of copper sulfate in emetic therapy? A. Inducing vomiting in cases of poisoning. B. Controlling diarrhea. C. Lowering blood pressure. D. Boosting immune function. The correct answer is A. Copper sulfate is commonly used to induce vomiting in cases of poisoning, acting as an emetic agent. How does sodium potassium tartrate help manage respiratory conditions as an expectorant? A. By causing bronchoconstriction. B. By reducing cough reflex sensitivity. C. By increasing mucus viscosity. D. By promoting the clearance of mucus from the airways. The correct answer is D. Sodium potassium tartrate helps manage respiratory conditions. It works as an expectorant, helping clear mucus from the airways. What is the main role of potassium iodide in treating respiratory conditions as an expectorant? A. Promoting airway constriction. B. Thickening secretions in the airways. C. Reducing ciliary movement in the respiratory tract. D. Aiding in the expectoration of mucus. The correct answer is D. Potassium iodide's main role as an expectorant in respiratory conditions is to help thin mucus, making it easier to cough up. In emetic therapy, what's an important function of copper sulfate in cases of poisoning or overdose? A. Preventing nausea. B. Enhancing absorption of toxins. C. Inducing vomiting. D. Stimulating the respiratory centers. The correct answer is C. Copper sulfate plays a crucial role in emetic therapy by inducing vomiting, aiding in the removal of toxic substances in cases of poisoning or overdose. How does sodium potassium tartrate help treat respiratory problems as an expectorant? A. By increasing mucus production. B. By suppressing cough reflexes. C. By thinning and liquefying mucus. D. By promoting airway constriction. The correct answer is C. Sodium potassium tartrate helps treat respiratory conditions. It does this by thinning and liquefying mucus, making it easier to expel from the airways. What is one medicinal application of potassium iodide for respiratory conditions? A. Treating high blood pressure. B. Inducing vomiting. C. Managing respiratory infections. D. Reducing fever. The correct answer is C. Potassium iodide is commonly used to manage respiratory infections due to its expectorant properties. In what form is copper sulfate typically administered for its emetic properties? A. Tablet. B. Liquid solution. C. Inhaler. D. Patch. The correct answer is B. Copper sulfate is typically administered as a liquid solution for its emetic properties, inducing vomiting. What is the medicinal application of sodium potassium tartrate in respiratory conditions? A. Reducing blood pressure. B. Increasing heart rate. C. Promoting mucus expulsion. D. Improving digestion. The correct answer is C. Sodium potassium tartrate is used as an expectorant to promote mucus expulsion in respiratory conditions.